Sure. And I just started recording this as well. So
Okay.
if anybody has questions, I can send you a link to the recording
Okay.
after we're done, and we can
Okay, that
share it
sounds
out.
great.
So okay,
All right.
so let me hopefully share my screen here.
Okay, I'll go ahead and introduce you to everyone. Good
Sure.
morning, everyone. Thank you for joining us at this early hour. We are meeting with Scott Reuter with Mobility Health Labs, and it's hopefully he'll be able to answer any questions you might have. And if this is an opportunity you find would be beneficial for your pharmacy, um, look forward to you supporting. And now I'm going to go ahead and pass it over.
Well, thanks, Pam. Hi, everyone. Thanks for joining me so early in the morning for you guys. It's 11 o'clock where I'm at. I'm on East Coast time, so not as I'm hopefully a little more bright-eyed and bushy-tailed than all of you are. But hopefully, as we were kind of noting there, I'm going to give you a pretty brief, high-level overview of our COVID flu PCR sampling and testing program. Open it up at the end for questions, and then provide some links and access to other resources that you guys can use to, if you feel like you need to research things a little bit more, you can do that on your own. I'll also share my contact information at the end. I am more than happy to and would welcome phone calls, emails, candygrams, texts, smoke signals, whatever it is, however you want to communicate with me. I'd love to answer questions, address concerns, and hopefully, um, help you make an informed decision. So before I get started, let me tell you just briefly about Mobility Health. We are a diagnostic services lab. We're based just outside of Cincinnati, Ohio. We've been in business for about 4 years. In addition to COVID and flu and some other upper respiratory diagnostic panels that we run, we also are into a field called pharmacogenomics, which has to do with genetic and drug interactions and helping doctors, pharmacists, and ultimately patients determine the best course of action for things like pain management, cardiology, all that kind of stuff. And then we do a lot of research for other labs as well, with some of the high complexity equipment that we have. We're called Mobility Health because we actually also have a fleet of mobile laboratories that we deploy to areas in need, areas where maybe it's a little more difficult for folks that live there to access the healthcare system in general and diagnostic services in particular. A story I told Pam the other day is we actually earlier this year deployed one of our units to the Salinas Valley, just outside of the Bay Area, earlier this year, and did some testing and vaccinations and other types of screenings with some of the migrant farm worker population that comes in seasonally to that area. So we deployed a unit and some personnel and provided some testing and like I said, vaccination services to those folks. Did it on a campaign basis, and then pulled out of there when the need kind of went away. And that's kind of that was the vision for our business when we got started. And then COVID hit, and like so many other diagnostic labs out there, we kind of had to jump into the fray and help fill the gap in terms of just the lack of labs that were out there able to provide, that not only high quality, but also high throughput testing that was needed. So we've been doing that for a few years. And then about a year and a half ago, I kind of through a friend of a friend ended up connecting with a couple of ultimately what I came to find out, CEPSN member independent pharmacists, and we kind of use them, so to speak, as guinea pigs to develop a system that helped them. Hang on, I think I've got to admit someone else here. Help them. Like I'll go into, minimize disruption to their workflow and offer some enhanced care to their patients. So that led to an agreement with the Ohio chapter of CPESN, where we onboarded a few dozen of their members, and then ultimately that led to an agreement with CPSN USA that's where we're at right now. I think the Ohio folks have had a positive experience. We likewise have had a wonderful experience with CPSN pharmacies. We also partner with some non-member pharmacies that are out there, and it's very easy for us internally to discern the difference between a CPESN member and a non-member. You guys just really align with us and, kind of our core values in terms of quality of care and also business practices and things like that. It's been a great relationship and kind of marriage for us. So we're really excited to expand it to the rest of the country. And I hope what we got to go over here will, be of value to you as well. So let me jump into it. Kind of a broad overview of what I'm going to go over here is just if you're not doing any testing or sampling now, this is a great opportunity, I think, to recognize or realize a new revenue source, but also provide some enhanced patient care. And I'll get into that a little bit. But we all want to do what's right by the patient, but this is something that I'm going to show you with a very minimal investment on your part in terms of time, a way to realize some significant new revenue, especially as we get into cold, flu, and other that other sick season, I guess. Again, we really built the program around minimizing the disruption to your workflow, and I'll go through some of the tools that we have in place to allow for that, which again will place the onus of things like information collection on the patient, him or herself, and then kind of everything from there with a couple of steps in between for you guys. The rest of it is kind of on us in terms of reporting and billing and all that kind of stuff. And then another thing just to keep in mind is at the end of this, if you decide that it's something that you want to, if you want to jump in or you want to kick the tires or try out, there's no investment whatsoever. There's no cost whatsoever. Everything we do is provided to you free of charge. We don't do things like minimum numbers of samples that we need to receive. There's really not a lot of risk for you. There's no risk for you, in fact, to join the program and see how it works best for you. So I talked at first about new revenue source. I figured I would just jump into that at first. I'd like you to really understand once you see the ask that we'll have of you in terms of what we would need you guys to do as part of the program. I want you to understand kind of what the juice you get out of that squeeze is. So for every sample that we receive from your pharmacy and test and ultimately get a result for, we pay you a $20 sample collection fee. And where that number comes from, just sometimes this question comes up, is when we submit everything we do, almost everything we do, most of the testing we do, we ultimately submit claims to insurance companies, whether it's Medicare, Medicaid, or private insurers. And when we do that, we submit it along with 3 CPT codes. One is for running the test itself. Another is what I call kind of a kicker that they offer. It's a little bit of a bonus for getting results out within 48 hours of us receiving the samples. I'll get into it a little bit, in a little bit. But typically, we get results out about 4 to 6 hours from the time we receive them. Everything we receive is shipped to us by next day air, so it's really a 24-hour turnaround time. So we more than meet the requirement for that kicker, as I call it. There's a better term for it. And then the third code that we submit is for the actual sample collection. And the Medicare reimbursement rate for that sample collection is right around $23, $23.50. And so we very purposefully set the collection fee that we pass along to you guys, because you're the ones that are actually doing the sample collection. We set that at $20 because for 2 reasons. One is we certainly don't want to be in a situation where we can be accused of providing an incentive or an enticement. Yep.
Sorry, I got a notification that there's some people waiting. I'm sorry to interrupt you.
Yeah, I'm trying to grab them and let them in as I'm talking. So I think everybody that's popped in or tried to pop in is is in here now. And for those of you that are
Okay.
new or that have just popped on, I'm also recording this, so anything you missed at the beginning will be available. Really, we're just getting into the heart of what we're here to talk about. But anyway, we don't want anything that we provide to be viewed as anything but a reimbursement or a passing along of a fee that we are, or a reimbursement that we're provided by the insurers. And then there's a little bit of a gap there between that $20 and the $23 or so reimbursement from Medicare, and that basically covers the cost of our cost for the collection kits themselves and allows us to not, again, have to charge anything to our pharmacy partners for their participation in the program. As part of our agreement with CEPSN USA, we've also got some onboarding assistant funds that have been set aside for the local networks, which hopefully they can apply to other priorities and things that you've got going on. We reconcile everything on a monthly basis. And so for some of the pharmacies that we've worked with or we are working with that maybe had been working with other labs in the past, this is a nice thing. We don't wait around until we necessarily get paid by the insurers before we pay you. We reconcile things around the 15th of each month, where we will run a report from our system. We'll send you a copy of that report that says, hey, Pharmacy X, we received 50 samples from you last month. We owe you $1,000, and we cut the check, or we have a way to, or we can get you set up with a direct deposit from us. So very clean and efficient process there. I think some other possible new revenue sources that are out there is one of the improvements, I guess, as we've gone along through the pandemic, is that some of the new treatment protocols that are out there do allow for more action to be taken, more actionable steps from the pharmacy standpoint than just go home if you're positive for COVID, get under the covers and stay away from everybody. There are some treatment options that are out there that require, in order to get a prescription for them, require a proof of a positive test. That test has to happen, or that diagnosis has to happen within a certain period of time. And so we think the efficiency and just the by nature higher and more the higher sensitivity and more and greater accuracy of a PCR test versus something like an antigen test makes that a more likely scenario, provides the patient a little bit more time, I think, too, after their onset of symptoms before they need to get that. It allows them to get that result and get a prescription written for some of those new treatments that are out there. So that's an opportunity, of course, for you guys to capitalize on that as well. And then the same thing on the flu side with Tamiflu and some of the other treatment options that are out there. So I'll get into in just a second what our ask is of you in terms of what we would like you to do with each patient that comes in looking for a test if you decide to opt in with us. But I wanted to take one quick step back and kind of tell you some of the things that we do. We're a CLIA certified laboratory. We are certified to the nth degree. I mean, it's a really just high quality laboratory that we've created here. We're very proud of it. We dot all the I's, all the T's, and we really have an efficient process that we've built that's allowed us to promise that and deliver on that 24-hour turnaround time I was alluding to earlier. It potentially can be even quicker for you guys because you're 3 hours behind us, time zone wise. So I think in most cases, when you send us samples one day, at some point the following morning is when your patients are going to be getting the results of those tests, which obviously that's a hugely important thing from their perspective. We handle all billing. Again, we bill Medicare, Medicaid, private insurance. If for whatever reason a carrier denies a claim, doesn't pay us what we've billed them, that's our battle to fight. We don't charge any copays to the patient, and we don't do any rebilling after the fact if we don't get ultimately what we're after or what we've billed. As long as the patient presents with symptoms and or a possible exposure, that makes them insurance coverage eligible. And again, if we run into those situations where the carriers are not paying what we ask. That's basically a cost of doing business for us, and it's not something that we would ever pass along to a patient. We do have a cash pay option available that we can bill for the patient if they don't present with symptoms or a possible exposure. This is for things like international travelers to countries that still require PCR testing. Some of the countries in East Asia are doing that, or if they need it for an event or any other number of things where an insurance claim wouldn't apply. We also handle all reporting to the states. Wherever the sample is collected, we're required to report the fact that a test has taken place and the result for each patient. We do that on a batch basis every night at about midnight, where all of the states that we are receiving samples from, they'll receive a report in whatever format is that they need it. Most of them use HL7. We'll send an HL7 formatted report to them, and they can add that to their records. There are some dinosaur states out there that still require faxes, and we do that as well. And then as we get into this cold and flu season, we'll have we have what's called a multiplex test available, which is excuse me, I was allowing somebody else in on the call, which is one swab where they can get a result for COVID and flu A and flu B. We're just now getting that part of that multiplex test, just now getting that launched. There have been some issues with the suppliers or the manufacturers of those tests getting specifically that flu B portion of their test verified or validated, because there just aren't that many flu B samples out there to validate against. But that's upon us now, and so we'll be offering that here in the next couple of weeks. So that's kind of gives you a basic idea of what we do. And then as far as what we want the other parties involved here, there is the patient and there is the pharmacy. I'll give you a brief, again, outline of what our ask is of them. The most time-consuming portion of a program like this is going to be information collection. And so our goal is always to put the onus or the burden on providing that information on the person who knows that information best, and that's the patient. And so we've developed a digital platform, basically a patient app or patient portal that links directly to our internal system that we ask them to use to, sorry, letting somebody else in again, that we ask them to use to register themselves in our system and ultimately register their individual samples as well. It's smartphone compatible, also works on a tablet or a desktop or really any digital device. It's very simple. We provide each pharmacy with a location-specific QR code and URL that they can provide to their patients. A lot of pharmacies will just post a hard copy of that code somewhere in the pharmacy. The patient walks in, they scan it with their phone, and they go to work filling out their information. We'll also provide you with digital renditions or digital versions of that QR code and, of course, the URL, so you can post it to your social media or your website or anywhere else that you think folks might want to find it, so that they can pre-register before they set foot in the door, so that when they get there, really all that's left for them to do is to sample themselves and kind of get out of there. As far as our ask of you is, once the patient does that, we just want you to verify that they actually did it. It's a very simple process. There's a confirmation screen that comes up when they're done that tells us that they've basically given us the information that we need. We just want you guys to kind of visually verify that they've done that. That's obviously a quick process. As far as once we receive their samples, we email and text the results or links to those results to their patient through encrypted links, where they'll be asked when they click it to enter their date of birth as a second form of identification. And then once they do that, a PDF of their actual results report will come up on their phone or their computer or wherever it is that they're accessing the report from. And then we also have something that just a basic provider portal that we provide access to each of you. We'll provide you with login credentials to it where you can go on and see things like those results reports for your patients. You can also get live updates on what's going on with your samples, because quite honestly, patients are probably going to be contacting you and not us, wondering what's going on. So you can always get a live look on what's going on, and you can use it to, like I said, access their reports if by chance they provided us in the patient app with an incorrect email address. And so they're not getting that email from us with their report. They can contact you. You can easily pull up their record and pass along that result to them. It's a quick link that you can create a PDF and print or email it to those patients. And then if necessary, if you have patients that either they don't have smartphones, they're not very tech savvy, or just unwilling or unable to register themselves, you can use that provider portal to register for them, either by phone before they come in, or certainly when they're on site in the pharmacy. I think that's the least common way that things are done. Most patients seem to embrace the idea of registering themselves in our system, but we do want that capability to be in your hands as well. And then we're also working with Pioneer on a direct integration of our results with that platform. And I expect that to be completed here in the coming weeks. It's a little, any of you that maybe have dealt with integrating anything with an EHR, EMR system, it takes a little bit of time. So we're going back and forth with them as we complete that integration. So again, patient is responsible for information collection largely. It's a really simple process. Like I said, here's what we ask of you guys as part of this program. One is just to help the patient understand how they are going to collect the samples. What we do is a self-collection. I assume most of you guys have either sampled yourselves or if you've done testing in-house, whether it's been PCR, antigen, rapid testing based, most of you are familiar enough with how to collect a sample that this won't be anything too terribly new. The only thing to note is that it's a nasal swab, an anterior nares nasal swab. It's not a brain swab. It's not an NP swab or anything like that, or a throat swab. It's a real simple, put the swab in half an inch or so into each nostril, twirl it around, or get a good representative sample for about 5 or 10 seconds per nostril, put it in a tube, put the tube in a biohazard bag. All this stuff is provided by us, and then seal the bag, and I'll get to the next step of how those samples get to us. Another step is the patient will need to hand write their name and date of birth on there's a label that's on their collection tube. We want them to do that just in case, for whatever reason, their sample gets separated from their registration, or any number of things that can happen. We want that written verification of whose sample is in which tube that we receive. We also supply a QR code, a small label with each sample that we ask the patient to place on their collection tube once they open that up. And that's what they'll use and these are in our instructions, but that's what they'll use to register their sample in that patient app that I was alluding to earlier. They put all that stuff into their biohazard bag. We ask that you guys either include copies of the front and back of their insurance cards, which can be slipped into the biohazard bag as well, or there's a way to upload it to the portals that I was referring to earlier. We're indifferent. I think most pharmacies still seem to, excuse me, most of them will just make copies of the health insurance cards. They'll do it while the patient is either entering their collection information or their registration information, or they'll do it while the patient is collecting their sample. But from that workflow standpoint, typically how it works, once you kind of have a feel for it, is the patient comes in. They have either already registered because they've had access to your QR code or URL to our patient portal. If not, they'll scan it there. They'll step to the side. Some people put them outside and have them do it so that they're not taking up space and or coughing all over everyone in the pharmacy. They'll enter that information. They'll be given a collection kit. They'll do that sample collection either, again, inside or outside of the pharmacy. They'll bring it back in. The pharmacist or the tech or whoever can verify that the sample looks good. The swab is in the tube is in the bag. The paperwork, if they've made copies of those insurance cards, is included. And there's a name and date of birth written on the label that's on the tube. And that's it. And then the patient steps out of there. And, by and large, after about a 2 or 3 minute interaction with the patient, you've got what you need, and that sample is ready to be sent to us. Um, as far as those sample shipments go, we use UPS. They have a diagnostic laboratory specific shipping protocol or program that they've developed. And so we will, again, at the time that you choose to onboard with us, we will have UPS send you all the shipping materials that you might need that'll get you through a few weeks. We will get you login credentials to our account on ups.com that will allow you to print labels yourselves. Those shipments will be billed to us. You don't have to worry about that. And then we'll also hook you up with a placard that UPS likes you to have or requires you to have that you use to schedule pickups by UPS anytime you have samples that are ready to be shipped to us. If those pickups happen on a regular basis, if we get into another quote unquote busy season where more days than not you have samples that need to be shipped to us, UPS or we will set up with UPS a recurring daily pickup that'll happen in maybe the last hour or so of the day that you're open. And you don't have to do anything. You just have to print the label, put it on the box, put the sample in the box, and UPS will kind of magically show up at the end of the day. Again, everything that we do is next day air. And so if you collect a sample today, we will receive it tomorrow, typically by about 10 or 10:30, Monday through Saturday. Those are the days that UPS delivers. That's Eastern time. And then usually within 3 or 4 hours, maybe a little bit more if something happens, but vast majority by early afternoon Eastern time, so mid-morning your time, results are going to get reported out again to the patient and to you guys through our provider portal. So that's basically the crux of how this thing works, how the program works. As far as how to get started, I'll run through this briefly and then we'll take some questions. I know we're running a little long here. CEPSN has a program enrollment gateway. The link is posted there. I'm also going to drop it in the chat here in a second that you can access. It basically is going to ask you for your pharmacy's NPI number, an email address that's associated with your membership. And then there's a drop-down list of programs that are available. And ours is just called creatively the Mobility Health COVID Flu Testing Program. What we've learned since the first time we've started doing these presentations is not everybody was aware that this program enrollment gateway exists within CPESN. And the reason for that is this is the first actually national program that CPSN has ever launched through this gateway. Everything before then had been a regional or a state level or even a local program. And so if you weren't part of one of those programs, you probably have never been exposed to this gateway before, but it's basically just an online jot form that you guys fill out. Once you hit submit, there'll be some verifications that CPESN does on the back end just to make sure that you're a member in good standing, essentially that you've paid your dues. And are set up to, they have all the information from you that they need. Once they've verified that, you'll get a second link from them, or you'll get a link from them that actually points you to the opt-in form or the enrollment form for our program. And that basically is just what it looks like here on the right. It's a very easy to fill out enrollment form where we're asking for things like the names of your pharmacists and their individual NPI numbers, the address, of course, of your store or stores that are enrolling, the hours of operation, and things like that. There's also included there links to see the actual service agreement that we have in place with CPESN if you want to see that. It includes a BAA so that we're on good standing in terms of sharing private health information. And then it's also going to ask you at the bottom to attach a copy of your W-9 so that we know who and where to send those monthly reimbursements or monthly collection fees, I should say, to. Again, once we receive that information, somebody from our end in a sales capacity is going to contact you. You're going to receive that location-specific QR code to our patient portal that I talked about earlier, as well as some credentials to our provider portal so that you're all set up there. And then shortly thereafter, you'll receive your collection kits and other materials along with a phone call from our logistics coordinator who will get you set up with UPS. And that's basically it. I don't know if any of you recognize this, but a while back, this implementation guide, as CPSN calls it, was sent out. I'm going to drop a link to that in the chat as well here in a second while we're taking questions, because it includes, in addition to kind of a general overview of what we talked about, links to things like the service agreement that we have in place. There's a video that we put together that talks about how to collect patient samples, register in our system, et cetera. And then it also has some instructional documents as far as how to register with our provider portal and things like that. Everything that's linked in there in this document that CPESN put together, hard copies will be included with the collection kits that you receive from us. But if it's something that you wanted to look at ahead of time, you'd certainly be welcome to do so. So with that, I'm more than willing to take any questions that you might have.
Scott, I think there is a question in the chat box.
Let me pull that up. Is the program similar to the color sample collection program? Unfortunately, Michael, I'm not familiar with the color sample collection. So if you want to elaborate, I can possibly answer it, but that's not something I've come across on my end.
Hey, Scott, maybe I can help answer that.
Sure.
This program is similar. Well, Michael, are you off? Go ahead, Mike. Go ahead. You're muted if you're trying to speak. Sorry. So here, I'll clear it up. Scott, Color is another company that was working with pharmacies in areas where the underserved populations were of a certain demographic. And what they did is similar to your what your company is doing. They sent out test kits for the patients to use, and the pharmacies would then send them back to Color Labs for test results. And this was solely for COVID testing.
Okay.
So it is a similar program. This one, Scott's program does go into further is COVID and flu, and the reimbursements are definitely a different makeup than the color one. So you'll have to if you're doing the color program right now, you'll have to make that decision whether or not to continue with them and go with Scott, or just continue with color. Hope that answered your question, Michael.
Yeah, I was actually in Southern California, gosh, a couple of months ago, I want to say, and had visited some CPSN member pharmacies at that time. I don't know if any of those that I visited are on the call today, but I had heard about some other labs that they had been working with and noted some of the differences that Pam, you talked about. I think the most common one that I heard about was that the reimbursement piece or the collection fee piece. I've heard, some labs do not pass along that fee, and I've heard others do it in different amounts that maybe aren't quite as much as what we're doing. Again, our goal here, overarchingly, is we want you guys to have an opportunity to provide an enhanced level of patient care. Again, that's always going to be primary, but we want it to be worth your while as well. And so again, that collection fee we're being paid by the insurance carriers for that when we submit a claim. We're not doing that collection. We feel that you guys deserve all of that. And that's why we do it.
Scott, I'm not sure, if anyone else, I mean, maybe this is something that what we'll do is we'll throw out your um, link again into our newsletter, and then for those of you on the call, you have Scott, I believe you threw the link in there. You said for them to sign up if they choose to.
I did. I threw the link in. It's the one that says that ends in constant contact. That's in the chat. I can also email that over so that you have that. I included a link to a brief, like I think it's 2 or 3 minute instructional video that really goes through in some level of detail, excuse me, sample collection, patient registration, things like that. And then my contact information is in there as well. So if, questions come up that you're not thinking of right now, or that, you'd rather just talk about one-on-one, my phone number and email address are there. I'm available anytime.
Does anyone have any questions or comments? Because I know we went a little longer than initially planned, but there is a lot of information here, and so please don't hesitate to ask a question now, or reach out to Scott after the call, and on your own. You don't have to ask the question here if you're not comfortable. But if not, we will go ahead and end the call here. And thank you, Scott. But please, if anyone has something to say, please interrupt me. Scott, thank you so much for your time this morning. And for those of you who are considering it, this is a great way to take care of the shortage of staff, and also taking care of your community. So I appreciate that, Scott, for bringing this to CPSN California, and we look forward to future contact. Thank you very much.
Sounds great. Thank you, Pam. Thank you, everyone, for your time. Really appreciate it.